Welcome back to Studio 4. You've probably heard about the parasite making headlines recently and thought, what exactly is cyclosporiasis and why is it getting so much attention? We have Dr. Rodney Young from Texas Tech Physicians Family Medicine joining us now in studio to explain what it is, what to watch out for, and simple steps you can take to help protect yourself and your family. Dr. Young, thanks for coming in.
I'm glad to be here.
And to start things off, Dr. Young, what exactly is cyclosporiasis?
Cyclospora is a parasite. It's actually a protozoa, if you can remember that from biology.
Okay,
so it's not
been a few years.
It's not a bacteria or virus like we're usually talking about, but it creates a foodborne illness that can be pretty substantial. That's why you're hearing terms in the media like explosive diarrhea and things like that. It can get into the intestinal tract. Some people will have a relatively minor and self-limited illness, so it can be hard to distinguish. Others, it'll just sit and smolder for a week or two and then hit you like a ton of bricks.
Oh my gosh.
Yeah.
Oh, so what are a few symptoms to be looking out for?
Well, probably the thing that, obviously comes to mind the most is you get diarrhea. So everybody's been there and done that, but this for most people is more than your usual course of diarrhea. It's oftentimes associated with what can be some pretty bad stomach cramps, can have nausea, vomiting, and really kind of the key distinguishing thing for many people is that not only is it profuse and watery, but it doesn't sort of wrap itself up in a day or two like viral illnesses that cause diarrhea oftentimes do. This can just linger and smolder, and if you're really unlucky, it can go on for weeks and not quite let up.
Oh
or
my gosh, that
get a
sounds
little
awful.
better and then worse again, so it can be pretty rough.
Wow. So you could, if you end up getting this, do you think you will be able to notice the difference between a regular stomach bug and then
Well, like I said, it runs a spectrum, so some people
Right.
have a not that terrible version. They may not really recognize it or know it. In fact, that's part of the challenge of figuring out the public health aspects of this is because there probably are a lot more people that have had it that we don't know had it because they had a more self-limited version or a fairly minor illness, so they didn't seek care and it was underreported in that context. But for most people that have it, if you got an illness that seems like a doozy, and it's not letting up at all after several days, then that's when we would start to consider this because we know it's running around. It's been found in, I think, over 40 states now.
Gotcha. And one thing that I have been seeing is to avoid produce like bagged lettuce, bagged salad mixes. What can you tell us about that?
Well, we certainly don't want to tell people don't eat fresh fruits and vegetables because those are good for you, but you do want to be very cautious about how you handle food and maybe modify the selections you'd make. So you mentioned bagged mixes. If you find a bag mix that is clearly labeled as thoroughly washed, that's probably a safer option for you than a bag mix that doesn't have that label on it. So you be careful about being choosy in that regard. You might choose to use like standard head of lettuce instead of something that's pre-bagged because the head of lettuce you can wash thoroughly, remove an outer layer or two, which is where the protozoa would likely reside, wash it again very thoroughly, and then you're less likely to get to the point where it would be contaminated.
That will be good. And is there anyone who should be especially cautious or have a high risk of getting this infection?
Well, anyone can get it that's exposed to it. Now, people who have weaker immune systems, so the very young and the very old, as with a lot of things that cause infections, those groups are more vulnerable. Now, it may not be that it would otherwise be more problematic, but usually they have fewer resources to deal with it. So if you have a profuse watery diarrhea, it's harder for an infant or an older person to keep up in terms of what's going in from the front end. So they run higher risks of getting dehydrated and therefore higher risk of having severe enough illness to land them in the hospital. They also, especially the elderly folks, they oftentimes have other medical comorbidities, and those things can get worse if you become weak and dehydrated. All those things settle in. So the consequences are bigger for them, and then the final group is people that are otherwise immunocompromised, like perhaps they're getting cancer treatment or something else that would modify their immune system and make their normal host defenses weaker. Those people have higher risks associated with things like this.
Well, Dr. Young, thank you so much for talking about, what to look out for and also cyclosporiasis. But do want to tell our viewers, keep it here because whenever we come back from break, we're going to continue talking about this outbreak. Keep it here. Welcome back to Studio 4, everyone. We are still talking with Dr. Rodney Young about the risk of cyclosporiasis poses and what you can do to mitigate it. And Dr. Young, we kind of talked a little bit more about this before the break, but what are some ways we can get or, fight this infection?
Well, the best way to try to protect yourself is to adopt good hygiene habits with respect to how you handle food. So one thing we oftentimes overlook, but shouldn't, before you handle the food in the first place, thoroughly wash your hands. Make sure your kitchen countertops are well clean, kept clean. Use something that's sort of sterilizes the surface as best you can to keep it appropriately clean. When you handle the food, wash the food thoroughly. I don't mean put it under the faucet for a few seconds to wash off visible things. I mean spend some time washing, thoroughly spraying down. If it's something like lettuce, I mentioned, that's layered, you can remove the outer layers so that you get the surface of it away and wash that thoroughly. All those things can help. And then, of course, the foolproof option, if you have foods that are amenable to this, is cook your food thoroughly. If you'll cook food, it'll inactivate this and you won't get sick from it, even if it was there in the first place.
Okay, no, that's very good. Are there any medications that we could take in case we have this?
Well, not so much on a preventive perspective, but if you have this and we determine that you have it, or you go to the doctor or healthcare provider with extended diarrhea, they will choose an antibiotic typically to help treat this. So we use a sulfa drug that's very active against this that typically works well. So for people who can tolerate that, that's a good option. There are ways to help bring it to an end, but it's not super easy to sort out that you indeed have it. It's a different kind of test than normal run-of-the-mill tests that we would do.
And Dr. Young, where can we go for more information about cyclosporiasis?
Well, it's all over the place right now, but if you'll look at the CDC's website for information about that, that would be a good, reliable source. And you certainly can visit with your healthcare provider, too.
Very good. So much great information that you just shared with us today. And again, we got to be very careful. We got to make sure to wash our hands.
Yes.
And just be careful when it comes to food.
Yeah, nothing quite as nice before you get ready to make dinner as a conversation about diarrhea and hand washing.
Oh my gosh. Well, Dr. Young, thank you so much for coming in. I appreciate it.
Thank you.
And stay with us. We have more Studio 4 coming up after the break.